So we shall now go on to our next speaker, Dr. Tapas Ranjan, who's a consultant vitreoretina services from LV Prasad Eye Institute based at Bhubaneswar. And he's going to be telling us about the utilities of red-free imaging in vascular retinopathies. On to you. And we will be having Dr. Muralidhar doing the discussion.
Good evening and greetings, and thanks for giving me an opportunity to share this simple yet useful technique, and that I use it frequently. So can you, are my slides visible?
Yes.
So evaluation of the superficial retinal blood vessels can be done in various ways, ranging from color fundus imaging, optical coherence tomography, angiography, fundus fluorescein angiogram, red-free fundus imaging. Now, fundus fluorescein angiogram, in addition to showing the blood vessels, it gives an idea on the dynamic properties of the blood vessels, which we usually don't get in other modalities. However, it has its limitations. So this being invasive, so we think twice before ordering it. There are, of course, contraindications, and the dye-related allergy, though rare, still they do exist. And of course, time consuming, we can't repeat it every visit if we want to follow up these patients with vascular retinopathies. Red-free fundus imaging is non-invasive, cheap, and the superficial retinal layers of the superficial retinal layers and the blood vessels stand out with excellent contrast. Say, for example, this one image taken with JS 450, the fundus photo that has been montaged. We can see the various lesions here. Now, if we do it in the red-free, we can see that the images become more prominent, the lesions become more prominent, especially all the cotton wool spots, the retinal hemorrhages, the exudates, the vascular lesions. Now, I realized that what I do, we usually stop here. Now, the moment if we zoom these images, then you start seeing much more lesions that we see in the fundus photography as well as in the indirect ophthalmoscope. Now, this is an image, that cropped image of from Optos, and it has been magnified, and we see that here it is 100% red, and we see that the lesions, as we keep on decreasing the red component and increase the green component, we see that the blood vessels become more and more prominent, and the vascular lesions are more apparent. You can see a neovascular front here, and if we make it again green, and here red 0, green 100%, we can see that there are numerous vascular lesions and probably capillary free areas here and a neovascular front here. So on zooming it out, say as per the requirement, if it is like I zoom it up to 303 times, 300 to 400, then the number of lesions that I see clinically, here in red-free, they appear more. Again, another example, the montage color fundus imaging, we can see that there is a sclerosed blood vessels. Now, corkscrew-like the front blood vessels here, and communicating blood vessels from here to from lower quadrant to the superior quadrant, and there are some lesions here which we are not sure what it is. And if we do the red-free imaging, you can see that the lesions are much more apparent, clearer. But again, to get a deeper look, one need to magnify. And if we magnify, we see that there is a neovascular front which is sitting right here, and then many more informations that we get from. Again, if you still magnify, you can see, oh my God, this one is running and compressing on this blood vessel. So we get better information with this red-free imaging, and still better if we magnify it. So there are hardly few literature on the utility of red-free imaging compared to the color fundus imaging vis-a-vis fundus fluorescein angiogram. These, for example, this group of this study from a study published in International Ophthalmology in 2012 showed that detection of most of the diabetic retinopathy lesions are better with red-free imaging than with color fundus. The red-free images revealed NVD and NV more often than color fundus imaging. This one by Chitra Jaydev et al. Utility of non-invasive imaging modalities in a retina practice. They showed that neovascularization and CNP areas, the detection rate is with red-free imaging is comparable to FFA. This one again a novel non-invasive detection method for retinal non-perfusion using confocal red-free imaging. They show that the plotting efficacy of non-perfused retina, like the retina free of devoid of blood supply, appear dark and featureless, and this can the plotting can be as close as fundus fluorescein angiogram. So with this, I had a question that how do they really help in the clinic? So we took up this study, efficacy of red-free imaging versus clinical color fundus imaging in detecting various retinal vascular lesions with FFA's gold standard. So 1.5 year study. So what we did at that time, we didn't have the wide field fundus cameras. So we used montaged color fundus image and with montaged red-free images, and the images were distributed to 3 retina specialists. They looked at the images at 3 different points of time, and FFA was taken as the gold standard for confirmation. 80 subjects, 129 eyes, had an DR followed by vascular occlusion, followed by vasculitis. Now the analysis was done with respect to the type, number, and extent of various retinal pathology, the diagnostic accuracy, the time taken to detect these lesions. So what we got it that in the detection rate of any lesion overall, the total confirmed lesions were much more, almost more than 2 to 3 times than the color fundus imaging. And we can see that in all neovascular, NBE, NBD, collateral, IRME, in all these lesions, the red-free had a higher score. This is the, and most important, the average time to detect individual lesions were much less with red-free imaging than the color fundus imaging. So if an image is given to us, a montaged red-free image, the time taken to detect various vascular lesions is much more less than the color fundus imaging. Now, the key points that we get here is the detection of neovascularization elsewhere, NBD, IRMA, collateral, sclerosed blood vessels. The rate and accuracy of red-free imaging is much more than color fundus imaging. Now, sometimes during clinical, in the busy clinic, during clinical examination, when we look at the fundus images and detect the pathologies, write down our notes. If we quiz ourselves and see all the cases, take the fundus images and see that whether did we miss any lesion, you will find that many times we do miss some of the lesions that gets picked up by the images. The time taken to detect an individual retinal vascular lesion with red-free imaging is less than color fundus imaging. Now, the qualitative the result that we got, the lesion morphology, the relationship of the lesion, vascular lesion with the surrounding structures are better with RFI. The montaged red-free images can give a good and quick panoramic view of the entire retina at a glance, and help in making sure that I am not missing any important retinal vascular pathologies. Helpful in a busy clinic when FFA is contraindicator or can't be repeated for multiple times. Magnified images in a bigger screen, the detection rate of vascular anomalies are better with either modalities. Still, RFI is better than C5.
You have 1 minute remaining, sir.
Yeah, I'll finish this case for 1 minute. This is a baby, 27-week gestational age, birth weight 700 gram. He came to us at 37 weeks of post-menstrual age, almost 10 weeks after the baby should have come earlier, and was from an ICU where the oxygen was given for 30 days. You can see there are arcading and shunting, and the media was hazy. This is the right eye, and the left eye. And again, the blood vessels, the numerous arteriovenous shunts at multiple level, and there is a corkscrew shunt almost running all around. So I wanted, if we want to analyze this better, again, some red-free, though we don't have a filter in those cameras, but we can do some red-free enhancement and get a better idea. The baby was too sick for laser, so intravitreal anti-VEGF was given, and we can see the baby. After that, the parents lost to follow for 1 year, and they just came. You can see this the image taken with 1 year baby with optos and the fundus image, and the corresponding rate-free magnified. If we see carefully, we can see that there is a neovascular font here. There is some sort of regressed fibrovascular polyp here, and the blood vessels they stop here. So now these avascular retina and the neovascular font is now enough for me to decide I'm going to treat this. Maybe I'm not going to leave it if I don't have an angiogram. So again, this is the left eye nasal quadrant. You can see that this is the color fundus image, and the red-free image. This is the new vascular font, again vascular avascular junction. But fortunately we had a angiogram available. We can see that this is avascular retina and confluent in the leak here and leakage from here, right eye and left eye. Finally, laser was done to this avascular retina, as is shown here. So, though definitely fundus fluorescein angiogram gives us a better insight and with more confidence. But if we don't have these gadgets available or doing it is an issue, red-free imaging do give us enough idea or adequate idea to take a decision on this treatment and follow. I thank you all again, and stay here and continue.
Thank you very much, Doctor. That was a wonderful talk, and we look forward to Dr. Muralidhar's discussions.
Wonderful talk, Tapas. You actually, now I'm quite happy to see that some of the things which used to exist before, are being rediscovered now, and more and more uses are being put. I remember, when we had the direct ophthalmoscope. I mean, we still have them, but I don't use them anymore. But it had a green filter, and we used to use that quite often, earlier also. And the green red-free filter, again, of course, this is not pertaining to retina. And now fiber layer analysis again became prominent with the red-free light. Tapas, with the in the glaucoma field, the now fiber layer analysis with the red-free light was quite practiced. But now the retinal surgeons are discovering the red-free light more and more with the newer imaging modalities. One question I wanted to ask you, Tapas, what happens to the choroid when you use choroidal lesions when you use the green light?
So these lesions are they are not prominent in green light. The choroidal lesions become prominent as we increase the spectrum and use
yeah, that way the red and the green are opposite. If you want to see the choroidal lesions, you shoot the red image, and if you want to see using the green image, the choroidal lesions tend to get hidden almost. The almost choroid becomes invisible. That's a very interesting phenomena. I use red-free filter in my clinical practice, especially when we are seeing a patient with severe NPDR looking for IRMAS, new vessel. Sometimes my fellow says it's a new vessel. Then whether it's a new vessel or a hemorrhage, there is a debate, and we tend to actually use the red-free light at that time and see these lesions much better. I agree with you. It's a very useful tool, but my own doubt is that we are not using it as much as we should be using it. I would love to hear from others. I have started using it more now, and I would love to hear from others, what their experience is. I think it's a wonderful tool which is underused.
Yeah, we can have comment from the other panelists. Yeah. Okay, Guru sir.
Yeah, I personally feel that red-free imaging was definitely, like Murali said, we used to use it in the past to see the nerve fiber layer and the hemorrhages and the superficial structures which it images. Maybe for the ERMs as well. Apart from the retinal structures, the epiretinal membranes also used to be better delineated with the red-free light. But I think in the present day, in the era of high resolution SLO-based imaging, I think we should resort more to multicolor imaging than to just red-free. Red-free has its own limitations. Like Murali said, the choroid is totally cut off. So we are more interested in deeper and deeper structures nowadays. So we should, I think, go for multicolor imaging if we have the facility, and try to image the RP and the choroid, because red-free imaging alone has its own limitations. With the multicolor imaging, we can actually see the CNVMs, the PCVs, along with the superficial structures. So I think we should have had a topic on multicolored imaging rather than just red free, considering that we are in 2022.
Yes, I agree. I think red free is great for your superficial retinal pathology, especially vitreoretinal interface pathologies. And I think you've mentioned that multicolor imaging comes. It's a great tool to look at all three layers, all three depths of imaging. But I would reserve it for VR interface.
Thank you.
Basically, red free is for retina, retinal vascular lesions. It's really good and really helpful. Yeah.
Sir, what NSM sir and Guru sir was telling, is there any, see, because of the improvement in the technology, and now we have the superluminescent diode kind of lasers, which we use in the OCTs and in the Heidelberg system. So does it make the lesions, as Tapas sir was telling, the lesions delineating more better and than what we used to have before? And that is why he is bringing it again, telling it that when we see his comparison between the color fundus photograph and the red-free images using the SLO based devices, he has showed somewhere around 70 to 80% kind of detection as compared to the 30 to 40% on the clinical based imaging. So does this SLO based is adding more this thing to that, or I just wanted to know?
I think it is SLO based technology that is adding more in terms of resolution, and not the flash-based imaging devices that we used to use before. That is what is adding to the resolution than the actual technology or the wavelength. Because I think the nerve fiber layer, if you take the nerve fiber layer, which we were discussing about, me and Muralidhar, I think there's a lot to gain from learning about what happens to the nerve fiber layer if there is a say a nitrogenic break during a diabetic vitrectomy or a drainage retinotomy close to the posterior pole. Beyond that, the nerve fiber layers tend to die, and as the closer you are to the disc, the larger the number of nerve fiber layers that can get affected, and this can be studied very well with SLO based imaging rather than with flash based imaging. So I think there's a lot to learn from that.
I think Muna madam wanted to make a comment. Yes, Muna madam, please.
Just a quick comment. Tapas, that was a very nice talk. Dr. Muralidhar, that sometimes a simple red-free photograph which is available on any basic camera system can confirm IRMA and new vessels. I think that's a cheap and effective way rather than getting a fluorescein angiogram or an OCT angiogram. I think we shouldn't ignore that use for it, even though we have advanced techniques. A simple thing like new vessels.
Thank you. Thank you very much for that.